Hello, everybody. It's Dr. Troy with Everything Disc. Excited you're tuned in today for this episode. We've got a special guest with us today, Dr. Gino Pasquale. He is a practicing doctor that helps with herniated bulged discs, helps people feel better, see it all day long. So, Dr. Gino, I want to welcome you to the show, and I'm glad you took some time out of your busy schedule to let our listeners know what you do, how we can help people. So why don't you take a minute and tell us a little bit about yourself, where you practice, what you do, and tell our listeners what
Hey
you're all
everybody, my
about.
name is Dr. Gino Pasquale. I work at Disc Centers of America, Vancouver in Washington, and I went to school at Life Chiropractic College West. We at Disc Centers of America, we specialize in working with patients that have disc issues, and we take care of them all the time.
How long have you been in
I've
practice,
been in
Dr. Gino?
practice for about 5 years.
5 years, and I know you grew up down in the Bay Area, if I'm not mistaken. You did some sports. Tell us a little bit about your sports background and how you got into
So
this thing.
I actually played basketball, soccer, track and field, and I was a decathlete in track and field. In terms of getting into chiropractic, I actually originally was going for physical therapy, and then some of the students from my school actually did a presentation, and one of the things that really stuck out to me was being able to see wellness patients, and that was like, oh, cool. With physical therapy, the only time you'll really see them is when they're sick, not doing well, injured, and then with chiropractic, it's like, all right, that's usually what we see when they first come in, but then we could see them when they're actually doing well and happy.
So what type of cases typically present to your clinic that you see? What are some of the common cases that show up?
So the most common cases that we get are low back pain and neck pain. Those are the most common, but since we do specialize in working with disc issues, we get patients who have those conditions, and that usually leads to pain radiating into their arms or their legs. And when they have that, it often makes it so just regular daily activities can be very difficult. Some of the conditions that you can see with disc issues are things like disc bulges, disc herniations, annular tears, stenosis, sciatica. Those are some of the big topics that you'll hear when someone says, I have a disc issue.
And what's the most common way they present to the office? What do they not only pain, like back pain or leg pain or arm pain, what kind of things aren't they able to do that they want to do
So
again?
often when someone has a disc issue, they often start losing some of their activities that they love. So a lot of golfers come in here and they're like, "Oh, I can't golf anymore." Or parents of kids that come in, they're like, "Yeah, it's really hard to take care of my toddler. Like I can't even pick him up." And they lose a lot of the things that bring them joy. And then we have some people that they're like, "Oh, I can't sleep at all. I'm only getting like a couple hours of sleep."
We tend to see that a lot with people. That's usually one of the big motivators is they're not able to sleep so good. I've been in practice 30 years and I see this all the time, but what's the traditional treatment that people have had that have come in and they're like, a lot of them will say, you're my last resort. I've done X, Y, Z. What are the X, Y, Z's that you've seen people do that aren't working for these disc stenosis herniation type
So the patients
patients?
that come in here, they often say, "Oh, I had cortisone shots, I had epidurals, I had physical therapy," and the last option that they're like, now they're saying I need to do surgeries such as like discectomies, ablations, debridements, infusions, and they're like, yeah, I don't want to do that. I want to preserve my back as much as possible.
Why do you think people wait so long to come see
So
us?
a big portion of why people often wait is just because for a lot of people, their mindset says, this was a minor injury. I'm going to get better. It'll get better eventually. And eventually, it just gets worse and worse and worse to the point where it's like, I can't even put on my shoes and socks anymore. That's usually the point where they start coming in and they're like, yeah, I have a problem.
And is there a point when spinal decompression might not be able to help these people if they wait too long?
The biggest time that I would say that they wouldn't really be able to get it is if they were to have like a full spine fusion. Like sometimes if you have multiple levels, it's like, okay, we can't address you at those levels, but we can address around those levels.
And that's usually what you'll see is the spine will start to fail after they've had a fusion. So usually the segment above and below will start to fail, and that's where we can help them out on that case. So, but a lot of people they might wait too long, and then there's a point when we can't help them. So that's why we always encourage people to come in, get checked, and make sure that their spine is working or we have an opportunity to work with them. And what types of care do you provide with disc patients? What's kind of a typical treatment protocol for somebody with a disc issue or
So there's multiple
stenosis?
ways that we take care of these patients. With a disc issue, we usually do recommend spinal decompression, also known as IDD therapy, which helps to get fluid back into the disc and also helps to bring more nutrients. That can actually open up the hole in the back where the nerve's coming out of by up to about 30%, which is usually enough to get people feeling a little better. And then we also use a red light therapy. The red light therapy helps to increase blood flow and helps those cells produce more energy, so it also helps speed up the healing process. And then, of course, since we are chiropractors at our clinic, we do adjustments as well. But it's not the typical snap, crackle, pop kind of adjustments. We actually use a technique called cox flexion distraction, which is a nice, gentle technique that's actually really good for disc issues just because it's a lot slower, so it's not as aggressive. And slower techniques usually work better when you have a hot disc. And then, in addition to that, we often give those patients some supplements. Some of the supplements that we give are Discat, which helps increase fluid retention in the disc and also works as an anti-inflammatory. It could actually help get fluid in the disc about 9 times more than just you're not taking it. And then we also use one called joint and disc pain relief, which helps to reduce inflammation and helps to bring those pain levels down. And then the last one that we use is something called chlorella, which is like a little superfood that gives your body a whole bunch of nutrients and helps to pull out some toxins like heavy metals.
And I know Chlorella is super anti-inflammatory. It's chock full of vitamins and minerals. And as you know, most people they say, "Oh, I eat really good. I have salad every day," but that's just a tip of the
Yeah.
iceberg, if you will. So, Chlorella is a really good way to help feed the body the nutrients that it needs for healing. So it helps speed up the healing
And
process. I know we talked
in
before.
terms
Oh,
of
go
heavy
ahead.
metals, a lot of these patients, they actually have high levels of heavy metals, and just because they're taking medications to help reduce their pain levels to make their life more comfortable. So they do have that heavy metal toxicity in their body.
And then before we went on the show, we were talking about some different cases, and I know you have a couple cases you want to share with our listeners today. Tell us about a recent success you've had with treating these patients with IDD or spinal decompression
So one of
therapy.
my favorite recent stories is there was this one patient who came in a wheelchair, and they were really upset because they went from being able to walk around, do what they needed, to being in this wheelchair, and it happened fairly quickly. As they were getting treated, towards the end of their treatment, they actually started to transition from that wheelchair into a walker. And this patient in particular, they are very passionate, and they're like, "Oh yeah, I want to get rid of this walker, but I'm happy that I'm using the walker instead of using this chair." So it was really awesome just seeing that person be able to get out of the chair and start to live life a little bit more comfortably and a little bit more normal for them.
Do you have any other stories that you want to share with our listeners? I know you got a bunch, but any that stick out in your mind?
Another one that stuck out in my mind was we had this one couple that was coming in. And with this couple, the male of the couple, they were, once again, they were in a wheelchair and they've been living very uncomfortable for years and years. And just within the last few months or so, they actually told me, like, hey, this is the first time in a really long time that I actually had no pain. I've been able to do my activities in the day and be able to live my life the way that I want to live it. And even the wife, they were saying, like, oh, yeah, his personality completely changed after feeling this way.
Yeah, it's pretty amazing with spinal decompression therapy, the results. I know the success rates anywhere from 86 to 92% if people are a qualified candidate for spinal decompression. What are your top, let's say, five health recommendations that you see people come in, their health's not where they want it to be? What are five things people could do to really start moving their health in the right
So
direction?
one of the best things that you could do is sleep. And I would say try to aim for about 8 hours. When you're sleeping, this is actually when your body does a lot of its own repair. So when you have an injury and you're not sleeping, it makes it harder for that body to recover. The next thing I would say is try to drink about half your body weight in ounces. And that's not all at one time. I would say
Mhm.
try to take little sips throughout the day,
Yeah.
just because if you do little sips throughout the day, then your body's going to stay hydrated. If you only drink all of it all at one time, your body's just going to pee it out of your system. So you're not going to stay hydrated. And then I would say eat organic food. Eating organic food is really good because it helps to reduce some of the chemicals that we're exposed to. when it comes to getting misalignments in our spine, there's three big sources. You have your physical, which are basically your car accidents, your falls, bad position, a bad posture, and repetitive motions. You have the emotional component, which if you're stressed, angry, sad, that can cause some chemical imbalances in your body. And then you have your environmental. So the eating organic really deals with the environmental because with your environment, you are exposed to chemicals in the food we're eating, the stuff we're drinking, and just the environment that we live in. And then I would say walking about 15 to 45 minutes is a great option as well. That's going to actually help to move some inflammation in your body. Your calf muscles are actually really good at working like pumps, and it also helps to keep your joints functioning better. And then I'm a little biased, but I would say the last one for me is staying adjusted. I would say getting adjusted about 1 to 4 times a month is actually really good because that's going to help to keep the joints functioning better and help the nervous system work better.
Yeah, I mean, yeah, I know you could add a ton more, but those are some of the basic key components, I think, to keeping people healthy and keeping them functioning. And you know, I I mean, we could probably spend all day talking about this stuff. I know we spend a lot of time together, but I know you know that I like to play golf, and I got a book coming out on how not to die playing golf. So I know you have some patients that like to see you that play golf. What would you tell them? What would be your number one thing to improve their golf game?
So with golf, it deals with a lot of the things that our low back doesn't like a bend, twist, and load. So one of the best things that you can do is get adjusted, and that will actually help to keep your biomechanics working the way they're supposed to. Ideally, we want our body to be mobile, and it's kind of like our car. If our car is not working good, it's good to see the mechanics so they could fix up your car. If your spine's not working good, it's good to see a chiropractor to make sure your spine's working the way it's supposed to. By having a mobile spine, it actually helps to prevent injury because if your spine's not moving the way it's supposed to, it's pretty easy to get injured.
Yeah, absolutely. So yeah, I mean, I've been talking golf for a long time, but there's 313 spinal joints, and that's our job is to keep those joints and discs and nerves healthy and functioning so you can perform at your best, well into your 90s. There's no reason you can't if you take care of yourself. So some good advice from Dr. Gino. Dr. Gino, is there anything else you want to tell our listeners before I let you get back to your busy schedule?
That's about it. If you have any information that you want from us, feel free to visit our website that has a lot of information about spinal decompression and some of the other types of therapies that we provide over here.
Good. And then we always tell patients, people listen to this all over the country. We've had patients fly in and work with us. We treat them for a while and then they fly back home once we get them better. And I remember a recent case, a guy from Maui actually had back surgery, started coming to see us. He had a complication from an infection. So he had to go get that addressed. And then he came back to see us for about 6 weeks. He lived over here and we've fixed him up, got him playing golf again. And now he's back in Maui and he's happy with the care, and he's sending all the people from Maui over to come see us to get decompression therapy. So kind of cool.
Yeah, that was a really fun case because you could just see his personality completely change as he started getting better. Like when he first came in, you could see life was kind of wearing down on him and like it almost looked like a darkness on
Yeah,
him. And then as he started getting better, you just see this big smile on his face, always happy to come in. And it was like the light started shining again.
yeah. Let that little light shine. That's what we do. Well, Dr. Gino, I thank you for your time and your information today. If anybody's interested in coming to see Dr. Gino or myself, our information will be in the show notes. So you can look us up and we'll be happy to help you out. If not, hope you guys make it a great day. And thanks for joining us on
All right,
Everything
thanks.
Disc.
Bye.